Not all ACL injuries require surgery, and we're going to go over what they don't tell you as a basketball athlete. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. We're going to go over why you probably don't need to have surgery after your ACL injury. Let's jump into what is the ACL. So the ACL is the anterior cruciate ligament, and the ligament pretty much is responsible for providing stability of the whole knee joint, especially in that tibia and femur bone. So the femur bone is a long bone, tibia is the bone right below that, and it provides stability in that anterior translation, so the knee going this way, forward and back there. So the big thing with the ACL is that it is a ligament. So there's different ways that a sprain could happen or a tear could happen. So an ACL injury normally occurs when there's some hyperextension or some anterior translation with some slight rotation. And it's usually traumatic. There's some kind of movement, you either land or you stop and your knee gives out. And between those ACL injuries, you have the contact and non-contact. Non-contact are the ones where, you see a basketball player driving, he does a Euro step and then he just collapses. Or you have the contact where you're driving and you stop and someone hits you and it forces that knee into that anterior translation and slight rotation there. So there's different types of those injuries that cause that ACL injury. From that ACL injury, we have to break down what is a sprain and was it a tear. So when you injure your ACL, you could have a sprain or a tear. And pretty much a sprain is just partial tearing of the ligament. Like I mentioned, it's a ligament. So when you sprain it, think about spraining an ankle. You're just partially tearing that ACL. However, the ACL is such a bigger and stronger ligament that when you sprain that and it provides stability in the whole knee, there's higher risk than just a regular sprained ankle. So there's different levels of grade of a sprain. There's grade 1, grade 2, grade 3. And it all depends on how much tearing there is. It's usually done via MRI or also the instability of it, which we'll go over later. And then you have the full tear also, where the full tear is just a significant sprain where it fully tears. And there's different ways. It could be torn closer to the tibial tubercle, closer to the tibia, or it could be right down the middle. There's all different variations, but that's the big differences between a sprain and a tear. What are the symptoms between a sprain and a tear? So we went over the differences there on the actual pathological side. So in regards to symptoms wise, they're both going to present very similar because there's some kind of traumatic injury involved, meaning like we mentioned, non-contact versus contact. So on both of them, you might potentially have some swelling in the knee joint. So you can't really differentiate between those two. You could also have some pain with it because of the swelling in the injury itself. And then you might have some instability on both. On one of them, you might have more instability. The other one, you might have less instability. And also, there's also a key component of normally an ACL injury doesn't just go by itself. There's other structures involved. And we have another video down below. Check out the description talking about all the different structures that could be involved. So then you also have the pain, swelling, bruising, potentially from the other structures that are involved from just an ACL injury, because you could have a sprained ACL with a torn meniscus, or you could have a full torn ACL with a torn meniscus and a torn MCL. So there's different variations, but when it comes to them, the really big differentiating factor is the MRI, the gold standard. It's going to be able to tell if that injury in the ACL is more of a sprain or a tear. All right, guys, so the big question, do you need to have surgery after that ACL sprain or ACL injury? So for ACL tear itself, if you have some instability, most likely, and in your younger athlete, you're most likely going to have surgery. However, for an ACL sprain, there's a lot of factors that might not lead to surgery. So one is the instability. Like I mentioned, if you have the true instability, meaning let's say you're walking and your knee starts to give out, or when you're going up and down the stairs, knee gives out, for simple little activities, then surgery is recommended. But what we've seen with a lot of athletes is that when you have an ACL sprain, most of them don't have instability with normal activities. They might have it with, significant cutting, but that's before they are doing any rehab or anything. But that's one of the big things, is finding out if you have instability or not. And some of the times you don't. So probably don't need to have surgery, especially if you consider other factors involved, such as your age. If you're younger and you're more athletic, you're an athlete, then surgery may be recommended even if you have a sprain, if you have some minor instability. However, if you're older, you're just a weekend warrior, you can get away with not having surgery for that. And then you also have, how intense your activity level, like we mentioned. So not only age, but also your activity level. If your activity level is very basic, hey, I just want to shoot some hoops, very minor on the weekends, versus someone that's playing 7 days a week, higher level, then we have to figure out, hey, do you have instability while playing those 7 games, or how intense are you playing? Versus someone that's just like a spotted shooter, or playing very low effort but still playing, that's significantly different. But the big thing when it comes to these ACL injuries, I tell people the rehab is the most important. So after you sprain your ACL, you have the ACL injury, you need to start doing your rehab as soon as possible. One, to get the homeostasis of the knee back in place, so really calm the knee down. From there, really strengthen the knee, strengthen the quad, the hamstring, the glutes, the calves. This is going to really bring back your strength. And then seeing biomechanically how we can improve your movement efficiency. These are very important factors, because if you just have the ACL injury, let the swelling go down, and then you go back to your sport, majority of the time your knee will give out. And it might not be because of the ligament, it might just be because the muscles are weak, because they atrophy while you're resting it. So the big thing is start on the rehab as soon as possible, get the muscles strong, and then find out, over time if you have instability or not. Because it could be that throughout the rehab process, we're doing some cutting, your knee's not giving out, then you probably don't need to have surgery most of the time. However, let's say we do your rehab, we get you strong, you're moving well, but you still have little minor instability, then you might need to have surgery because the ligament is not providing stability to the knee. However, because you did all this work before the surgery, you're going to go into the surgery really strong, moving really well, and that's going to improve your outcomes. So it's a win-win. I usually tell people whatever you want to do or decide, you got to do rehab first. And then after rehab, usually like 2 months, I would say 2 to 3 months, then make a decision if you need to have surgery or not. And the majority of the times that we see with these ACL sprains is they get better and they don't need to have surgery. However, there's a couple where you have still that continued instability after the rehab, but that just makes their surgery process outcomes much easier with that. All right, guys, so what are the risk factors? Everyone asks, how about if I don't have surgery? Is my knee going to get worse? So the big thing with the risk factors is there's a couple things. So unfortunately, because you had an injury, regardless if you have surgery or not, you are at an increased risk for early onset of arthritis. Doesn't mean you're going to get it. You just increase your risk, because whenever you have any significant injury to a ligament, even if you get it reconstructed with surgery, it throws off the mechanics of the knee originally. So that's going to throw off a little bit there with the knee joint, which is going to increase your risk for early onset of arthritis. Also, if you have a lot of instability and the knee just moves around too much, you might increase your risk for meniscus issues or other ligament injuries as well, because the knee is just not stable. And that's where, surgery might help provide stability if your knee keeps giving out. But like I mentioned, these are all just risk factors, but rehab is a big thing that's going to help decrease these risk factors and provide stability. And then if you have surgery, you're in a better position to go into surgery. So to conclude, guys, when it comes to an ACL injury, we got to figure out if it's a sprain or a tear. A tear, if you have a lot of instability, your knee's giving out, and you're athletic, surgery is highly recommended. For a sprain, if you don't have instability and you work on your rehab, most of the time you don't need to have surgery, but you got to keep an eye out throughout the process if your knee's giving out or not. Worst case scenario, let's say you do need to have surgery, as long as you strengthen it throughout the process, makes the recovery of the surgery much easier. So hopefully you guys learned a little bit about ACL injuries, why you probably don't need to have surgery for some of them. And if you guys have any questions regarding ACL injuries or need help with your ACL recovery, put a comment below or send us an email. We help with people online and also in the Southern California area. And hit the subscribe button and then share this video with friends and family. And let's ball for life.